Ladies and gentlemen, a very good evening to all of you, and it's a great pleasure and it's an honor to introduce one of the key respondents. Here is Dr. Ashok Dhoble, sir, who is the Honorary Secretary for the Indian Dental Association. Before that, let us give a short description of what 3D Graphy News is all about. 3D Graphy News is a platform which is an information source that we have started a year back, with a clear intention to and keep the industry informed about 3D technology, which consists of 3D printing, 3D imaging, 3D design, 3D visualization, and also very important is simulation software and also material science. Ladies and gentlemen, we are looking at the cusp of the information getting sourced through various different channels. So 3D Graphy News is been a platform engaging with end users from aerospace, defense, automotive, and also dental and medical and orthopedics and spine, and also bioprinting and tissue engineering. And this has been our conscious endeavor to see that how we can keep the industry well informed about this technology, so that the larger intent for us is to see that how democratization of 3D technology can be a good, useful process for the end user. Because at the end of the day, the patients should benefit from this technology is our larger goal. So it's been an honor and a pleasure to connect with experts from various different domains and expertise. And today I have the privilege to invite Dr. Ashok Dhoble sir, who has really been an active respondent for almost 20 plus years in terms of ensuring that how the dental community can benefit from various different sources and active connectivity in terms of seeing that how the community can benefit from various different technologies. And he has been in championing this process, and today we will have a talk on 3D technology in terms of how 3D technology can help the industry overall, and how this can actually benefit the dental community going forward. Good evening to you, sir, and thanks for your time. And I would like to understand from you, sir, in terms of how 3D technology is actually helping the dental fraternity going forward, because I know that you have been doing a lot of work and you have a fantastic center of excellence, the Dr. Abdul Kalam Center that you have been able to formulate here in Mumbai. And I did have a couple of visits at the center. It's one of the best centers that I can actually have, I can assure. Sir, but even then, how did it all start, sir? What was your larger vision, sir? Please. Thank you, sir.
Thank you very much, Dr. Shibu. It's a really great pleasure and very happy to associate with your mission and vision, what you are from the last 10 years you are carrying out. And dentistry, particularly, it can benefit largely as compared to other specialties of the health, since dentistry involves is art and science. And as 10 years before, 15 years before, what used to dream and imagine, today it has become the reality. And to the great extent, the kind of the technology has come, it will benefit the public at large. And dentistry is known to be, since art and science, the amount of work is to be carried out by the dental professionals while treating patients. And we used to find number of limitations while carrying out the work or producing our outputs, but which can be easily now can be accomplished with the 3D printing technology. In terms of, because we deal with the face of the patient. When you deal with the face of the patient, that is the most important aspect of the body, where to the large extent, the aesthetic value, the look of the patient, and particularly the number of diseases associated with face of thought, let's this technology bring to our country. We have the huge population in our country, and most of the population, they cannot afford so much time to spend on the dental treatment and the cost of the dental treatment. With the help of the 3D technology, We can bring the cost of the treatment also come down. The time what is required for the dental treatment and all the procedures, it can be drastically reduced by using 3D technology. And with by this keeping in the mind, the IDA is now focusing to bring the 3D technology in our daily use. And what our imagination and dream about the dentistry, really, when I learned the dentistry 30 years back, and that time we used to have the, very difficult to imagine about the 3D. Difficult to imagine the computers. There used to be our questions and essay topics on the computers, application of the computers in dentistry. And to write such dissertation, we used to find difficult. But today, the computer, without computer, we cannot live, we cannot survive. So by getting this and along with the 3D technology, we can give the best of the result to the patients, and it will another important aspect of the patient's confidence level in the entire treatment. They put high level of the confidence in the dentistry, and same time they also get that kind of the output. So thank you, Dr. Shibu, for really getting associated with us and helping us to achieve our goal in terms of dentistry, which can be done easily, which what I feel.
Very true, doctor. And as you rightly said, sir, Indian Dental Association has always been in the forefooting in terms of ensuring that how patient satisfactory index can also be taken into consideration. Because globally, patient needs to be satisfied, sir. And I when I came to your center, I was so really amazed in terms of, and I was not aware that you also have a wing which is for social cause in terms of helping the needy without any financial, it has actually been done in charity. So such a great initiative, sir, that you're also doing. But I also realized for the fact that overall patient satisfactory index, which is a global term, is also a very conscious effort that needs to be there in Indian context. What do you think about patient satisfactory index, sir? I mean, when it comes to satisfaction for patients, and with 3D technology, I saw in your center that you have this software which can also give a clear, image experience for the patients also to know where and what is the case that he or she might be going through. So that's a very beautifully designed center, what you have in Mumbai. So what do you think about patient satisfaction index, sir?
The patient satisfaction is the most important in the dental treatment or any aesthetic treatment, cosmetic treatment for the patient, because many times they don't imagine what is the kind of the results they are going to get. But with the help of this technology, software applications, we can predict much more before we start the treatment. And when they see the prediction, this is likely the outcome of their treatment, their satisfaction increases, their confidence level increases, and the most important, since it is a phase, many times they feel they are taking, some kind of the chance to undergo the treatment. That is not all taken care, because once you show them the prediction, it changes entire their concept, their thought process, and they agree for such treatment.
Very good, sir. And also, doctor, we also understand the importance of material science. New materials are coming actually, which are bone-like materials now for patient-specific implants. With 3D printing, you can use these materials for surgical guides and fixtures and various planning for your surgery. I'm also talking about maxillofacial reconstructive surgery also, sir, and also implantology. The things have become very easy. So when it comes to even materials, when it comes to implants, maybe a mandible that needs to be implanted with a material which is a bone-like material. A lot of research is going into it, sir. And I see a center which also has, which is really looking at, setting that particular landmark for also researchers to join your center, sir. That's a very great initiative. What do you think about materials, sir, going forward in the space of dentistry and oral health?
In terms of particularly in our country, we have world's largest cases of the oral cancer in the country. And most of the patients, they report to the dentist at the last final stages, where the dentist has no option other than removing the jaws, jawbones, associated structure, and that time the disfigurement of the face, what it happens. It can be easily much before the prosthesis can be prepared by using artificial bone. And these are the definitely different materials are coming. Their properties are matching toward the bone, and accordingly we can get the best of the results. What 5 years it was before, and today and yesterday and tomorrow it will be again changed. So up to that level, the materials are new materials are coming. We can take advantage of the properties of the materials, and it can be produced like bone. It will act like it can become the substitute of bone. No need of having the surgery of the ribs or other part of the body and take out the bone from there and put in the area where the surgery is done. We can prepare the prosthesis before doing the surgery itself, so that immediately after surgery this can be inserted, and no need of any patients having any scar on the face. And almost patient, it won't appear that patient has gone under some surgical process.
Very true, sir. And also making it a very smooth process for everybody to benefit, even the patient as well as the surgeon, to make it a successful surgery. Doctor, one more thing is, what is the value creation impact of IDA as an important autonomous body with a vast reach of promoting 3D technology in dentistry? Because you have a huge audience and huge member base. And how does how do you think that you can impact in terms of with the technology?
In terms of the technology, with some modifications, what is required as per the dental requirement, which can be researched in our center also, and we can have the huge, our membership strength is more than near about 125,000 dentists that are practicing in the country. And it can benefit, it can go to every dentist, and when we bring down the cost, so affordability in the 2-tier city, 3-tier city, it can happen. And through that we can easily, we can cover the large number of the population of the society, and which is of the very utmost importance.
Very true, doctor. And because the scale and the size is so very defined, we can also try and communicate to these audiences for various new products and new solutions, medical devices in dentistry. Doctor, one good solution is sleep apnea devices, which is actually gaining a lot of traction. So we have a body within 3D Graphy to have designers to come up with these solutions, because snoring is a real concern that can also cause health hazards eventually. So I think, so when it comes to awareness, this creating that kind of a platform would be and through the platform would be really a great exercise. We strongly believe in terms of how IDA can really be a channel for promoting these and creating awareness. Doctor, one more thing is, how do you think the potential of our collaboration between IDA and 3D Graphy can help us to take the initiative of 3D digital dentistry in the next to the next big heights?
I see the great opportunity. We can use the strength of each other, and once you do that, definitely it will benefit, and the amount of the time will be required will be very, very less, and we can move very fast, because today's thing, tomorrow it will become obsolete. So every day we need to be upgraded, updated with a new concept, and with our relationship, definitely it will benefit more than what we expect.
Thank you so much, sir, for your active participation for this time, for this interview. And I hopefully am very sure that 3D Graphy and IDA working together in agreement can take the course forward. And I'm sure democratization of 3D technology with a scale that I can understand from IDA, what we can achieve, we will be able to accomplish, sir. It's a done venture, and this will definitely help the community at large. Thank you so much for your time, sir, and your because you're getting your time is very, very precious, because you're such a busy person at every minute and every second. And thank you so much for your time, sir. And I can see the vision that you have, sir, and we will definitely work towards that vision, and we will definitely be able to achieve it. Thank you so much, sir.
Thank you very much, Dr. Shibu, and definitely we will work together for the betterment of our society.
Thank you, sir. Thank you, sir.